My name's Gail Mander, and I'm a specialist nurse for tissue donation, and I work for NHS Blood and Transplant. I'm one of 5 specialist nurses who work with healthcare professionals around the country, increasing awareness around tissue donation and setting up referral systems for tissue donation. As you may be aware, in May 2020, the law around organ and tissue donation changed to an opt-out system. And this change opened up many questions for healthcare professionals, particularly those looking after patients at end of life. This presentation will help nurses understand what tissue donation is, their responsibilities in relation to the legislation, and how they can ensure that tissue donation can be incorporated into everyday practice. So NHS Blood and Transplant is an NHS organisation, and it's the UK's major provider of human tissue for transplant. Its role is to consent, retrieve, process and store and supply human tissue grafts for use in surgery with the NHS and independent hospitals within the UK. We bank and supply tissue grafts from around 3,000 deceased tissue donors per year and respond to over 20,000 donor referrals. This results in over 4,500 corneas per year for use in ophthalmic surgery to restore the gift of sight for these patients. Our main site is in Speke in Liverpool, and this houses the National Referral Centre, our dedicated donation facility, our processing suite, and customer care. So the hospital development team are 5 specialist nurses who work in England and Wales to help promote and develop tissue donation. We have 3 regional nurse practitioners that cover England and Wales, and 2 specialist nurses for tissue donation that work within the South Central organ donation team. We're regulated by the Human Tissue Authority, and this oversees compliance with the Human Tissue Act 2004. They also oversee compliance with laws that ensure that the quality and safety of organs, tissues and cells used for transplantation in the UK. There's various legislation throughout the UK. In England, the Organ Donation Deemed Consent Act 2019 introduced an opt-out system of organ and tissue donation in England, otherwise known as deemed consent. This means that all adults in England are considered to have agreed to be an organ and tissue donor when they die, unless they've recorded a decision not to donate or in one of the excluded groups. In Wales, the Human Tissue Transplantation Act 2013 also introduced an opt-out system of organ and tissue donation in Wales, otherwise known as deemed consent. This means that all adults in Wales are considered to have agreed to be an organ and tissue donor when they die, unless they have recorded a decision not to donate or in one of the excluded groups. Northern Ireland has an opt-in system for organ and tissue donation, and this means there is no presumption that you would want to be a donor after your death. This is reliant on patients having a discussion with their family about their wishes after death. In Scotland, the HTA doesn't oversee consent for deceased organ and tissue donation, but from March 2021, Scotland will introduce an opt-out system of organ and tissue donation, otherwise known as deemed authorisation. The opt-out system is sometimes known as Max and Kira's law, and you may have seen some information around this on the website or in the press. So what are the differences between organ and tissue donation? Both enable recipients to lead a normal life and bring great comfort to donor families. When looking at organ donation, we're referring to solid organs. So this may be livers, kidneys, hearts or pancreas. Approximately 1% of the population are eligible to be able to donate organs after their death. The patients have to die a controlled death in an intensive care setting. and retrieval must take place within 4 hours of asystole. The organs themselves must be transplanted within a few hours after retrieval. And we also have a living donor programme where kidneys and livers can be donated. Tissue donation involves tissue such as ocular tissue, heart valves, skin and bone. This surgery is life-enhancing. Up to 50 recipients can benefit from each donation. And unlike organ donation, most people can donate tissue. Death can occur anywhere, and the patient does not need to die in a hospital setting, but can die in a hospice or at home. Retrieval takes place within 24 hours, and some tissue can be donated up to 48 hours after asystole. Tissue can be stored between 28 days and 10 years, and we also have a living donor programme for bone and amnion. Most patients can donate tissue after death, but there are a few exceptions. Patients with confirmed COVID infection or suspected COVID with symptoms in the previous 28 days are contraindicated. Patients who are not showing symptoms or who have had COVID previously may still be able to donate. Most patients with cancer can donate ocular tissue. The exceptions to this are hematological or ocular malignancy or malignant melanoma with no metastatic disease. Blood-borne viruses such as hepatitis B, C or HIV. Risk factors for Creutzfeldt-Jacobs disease or its variant, for example, dementia or progressive memory loss where there is no other cause. And neurodegenerative disease or diseases of unknown etiology, such as dementia, Alzheimer's, Parkinson's, and multiple sclerosis. If you're not sure if a patient can donate tissue, you can put in JPAC in the search engine or blood transfusion guidelines, and this will take you to a web page that will give you the donor selection guidelines. Alternatively, you can call us and call the National Referral Centre on 0800 432 0559, and we will be able to advise you. Did you know that as many as 50 people can be helped by one tissue donor? So tissues such as heart valves, skin, femoral arteries, corneas, tendons and meniscus, and bone can all be donated by patients after death. I'm going to go through some of the tissue that can be donated, and the following slides may contain some graphic pictures of surgery and donated tissue. So eye donation is the most common tissue that can be donated by most patients. It's also the tissue that most patients are waiting for transplant. Corneas can be donated from the age of 3 years old, and patients into their 80s and even sometimes into their 90s may still be able to donate corneas, providing they have good eye health. Most people can donate corneas even if they have cancer or poor eyesight, so there's very few exceptions to those. The whole eye is donated, but we use the cornea or the clear lens part of the eye to restore sight in patients, whilst the sclera or the white part of the eye is used in reconstructive surgery. Each eye donated can potentially help up to 5 people. Corneas can be stored for up to 28 days and sclera can be stored for up to 1 year. With any tissue that's donated, the donor is restored to a normal appearance, and in the case of eye donation, the eye is reconstructed and gently closed. The donor will look asleep. As with all donations, the family can view the body following retrieval. I'm going to play you a video of Laura's story. Laura received 2 corneal transplants, and as a result, she can now watch her son grow up. This is Laura's story.
The doctors never found out why my eyesight failed. It was all just a blur. I couldn't live a normal life. Imagine never being able to see your child's face properly. my son grow up is the best gift I could imagine. Donating sight can enable people like me to see again. Thanks to the kindness of a stranger donating their corneas, I can work, I can drive, I can walk through a crowd without bumping into people, and I can see my son's lovely smile. Help people like me see what they can only imagine.
We're all dealing with difficult times, and the effect of COVID has had immense difficulty for everybody. COVID has had a particular effect on ocular donation and demand. So as COVID hit, elective surgery was stopped and ocular donation was reduced to a level to meet emergency requirements only. As signs of elective surgery restarted, ocular donation was restarted. However, corneas only have a 28-day lifespan and tissue stocks were severely depleted. Even if donations hit their target, there will still be a shortfall of cornea supply in the UK and hospitals. And the NHS BT strategy is to increase donations above that target and enable people to have the gift of sight. Heart valves are used to replace damaged or diseased valves in patients, and the vessel associated with the valve may also be used to reconstruct congenital heart defects in children. Human heart valves have a better clinical performance than artificial materials or animal source grafts when used clinically. Sonia received a heart valve transplant at the age of 17 that transformed her life. She was born with a congenital heart defect and grew up knowing that she would need a heart valve transplant at some point. When she was 14, she noticed that things had started to become really noticeable and she wasn't able to walk across the street or speak to somebody without being breathless. Walking over the road would feel like a marathon. She was 17 when she had her heart valve transplant, and this gave her a new lease of life. She became so accustomed to being unwell and unable to do everyday activities, so being able to do all the things that she loved doing before, such as tap dancing, was amazing. Sonia tap danced for 12 years before her operation and had to give up due to illness. She's now dancing again, and 5 months after her transplant, ran a 10K race. She's now completed her university education and is living life to the full. Skin is primarily used for the treatment of serious burns, and it forms a temporary dressing which protects the wound whilst the patient heals. You can see in the picture that it's a very thin layer of skin that's used for skin dressings, and it's almost the thickness of a blister. Skin can also be prepared to a decellularized dermis, and this is used to help repair damaged tendons or heal wounds caused by ulcers, trauma, or surgery. It forms a scaffold which the patient's body uses to regenerate the damaged or lost tissue. To bring things into context, approximately 3 to 4 donors are needed to treat one burns patient. And donated skin can be stored for up to 5 years. Bone allografts are used to replace lost bone in patients. This may result from bone being removed due to a traumatic injury or a bone cancer, or because the bone itself has deteriorated and worn away due to age, or after an artificial joint has been implanted. Bone can be used in many ways, either as an allograft, as a large graft to provide mechanical support, or it can be ground or morselized to fill gaps. Iliac crest is used to produce tricortical wedges, and this is used in spinal surgery. Again, bone allograft is more effective clinically than artificial bone replacement materials, and over time it's reabsorbed and replaced by the patient's own bone. It heals in a very similar way to a fracture. Tendons and meniscus. These allografts are used to replace a young patient's knee or cartilage when it's damaged, and this delays the requirements for knee replacement surgery. Surgeons try to avoid knee replacements in younger patients as they have limited lifespan. If they fail, they can result in the patient requiring amputation. Ankle tendons are most frequently used for the replacement of damaged tendons in the knee, and the graft helps to stabilize the knee joint, restoring mobility and freedom of movement, and preventing further damage to the knee that could result in the patient requiring a knee replacement. It also avoids the need to take a graft from the patient's other leg, which can be painful and debilitating. Each tendon donation could potentially help up to 8 patients, and tendons can be stored for up to 5 years. Meniscus can be stored for up to 10 years. This is particularly beneficial for younger, sportier patients and enables them to lead a normal quality of life. Femoral arteries and nerves. So femoral arteries are used to replace damaged arteries or infected artificial arteries. And they're mainly used when conventional treatments have failed and represent the treatment of last resort for very ill patients whom surgeons are seeking to provide an additional span of good quality life. Femoral nerves can also be used and are decellularized, and these are used in the repair of damaged peripheral nerves. Femoral nerves can be stored for up to 2 years, and femoral arteries can be stored for up to 10 years, and one donor can help up to 4 people. So what are the barriers to donation? A lot of people say they never thought about donation, or they thought it was somebody else's job. People can understandably be reluctant to discuss donation with patients because they don't feel they know enough about the subject. They're worried about getting it wrong. Sometimes it's because there's no system in place and people don't really know what to do, how to make a referral, what they should be doing. And assumptions are quite often made about suitability. And quite often we hear that patients weren't referred because they assumed that the patient wasn't suitable for donation, or that it was somebody else's job to do so. The other assumption is that patients will tell us that they want to donate. The reality is that most patients are relying on us as healthcare professionals to have that conversation with families. They will assume that if you don't ask them about donation, that they won't be able to donate. It's far better to get it wrong and offer the patient the option of donation than not to offer them the option of donation at all. The biggest barrier to donation is us as healthcare professionals. So speaking to families about donation. So it should be a normal part of end-of-life discussions. Ask the family or the patient if tissue donation is something that they would like to explore. Explain that this can be explored further with them at the time of death. So when you're asking about donation, you're not obtaining consent, you're just asking the family if it's something that they want to explore. Following death, permission must still be obtained from the family before a referral is made to NHS Blood and Transplant. A specialist nurse will talk to them over the phone and answer any questions. Because tissue is usually retrieved within 24 hours after death, a nurse will contact them later that day or the following morning, so quite soon after death. The other thing is you can give the family a leaflet about tissue donation. This has the website address and it's also got a telephone number that the family can contact if they would like to speak to a specialist nurse directly. You do not need to know a lot about tissue donation to be able to ask the family or to refer a patient. Reassure the family they do not need to make a decision straight away. The specialist nurse will talk through the process with them and give them time to come to a decision. Donation does not delay funeral arrangements, and the family can still see the patient following tissue retrieval. This is Andrew's story. His daughter Vivian talks about the tissue donation process and what it meant for her.
But he was really, really obsessed with being in good physical shape and being able to do whatever he wants to do. So every day he used to run to work, and that's a couple of miles. He used to run that there and back every day. He did all sorts of things. So he would get obsessed with something, and like really obsessive over, say, windsurfing. You know, he'd do it obsessively every single weekend, go out windsurfing, and he'd eventually get bored and sort of stop using it. Dad had probably the most aggressive cancer that the specialist had ever seen, is what they said. That so when he was just feeling a bit off in the summer, that was the pancreatic cancer, and when it started to hurt him, that was the liver cancer getting hold. The thing about cornea donation is the cornea is the clear part at the front of your eye, and there's no blood supply, and that's why cornea donation is still possible if the donor has had cancer. Mum said they didn't really discuss organ donation before he died, but she knew that he would have wanted it. Dad's eyes have both been used for different patients, so Dad helps 2 people to regain their sight. I wouldn't say it makes it better, but it's something that a good thing that's come out of a dreadful thing. Yeah, so he won't get to see my children grow up, but the people who got his eyes will be able to watch their grandchildren grow up, instead of not being able to see them. And that's really important. That means something.
So how do you make a referral for tissue donation? So first of all, the patient needs to die. Consider if the patient has any contraindications to tissue donation. You can look up the JPAC guidance on the internet, or you can give us a call and discuss donation with a specialist nurse directly. Most importantly, has the patient expressed a wish to donate? With the new legislation, unless a patient has opted out of the organ donation register, it's assumed that that patient would want to donate. You need agreement from the family to refer to NHS BT tissue and eye services. And you need to call the referral centre on 0800 432 0559. The specialist nurse will check the organ donation register and assess suitability for donation. All donation is discussed with family by the phone, and the family are given time to consider options. Consent for donation is taken by phone. The information you require at time of referral is quite simple. The patient name and hospital number, or the NHS number, the age and date of birth. This gives us time to check the organ donation register and find out if the patient had expressed any wishes. The time and date of death, the reason for admission, and any past medical history. The next of kin contact details. If you have a very elderly, frail relative, it could be a son or daughter, whoever is the best person to speak to us by phone. The GP and surgery name, a summary of medical treatment during this admission, and any other information you feel may be relevant. So what happens once we've had the referral? So the referral's received in the NHSBT National Referral Centre in Liverpool. The specialist nurse assesses the patient for suitability, and if the patient is a potential donor, the organ donation register is then checked. If there are no restrictions to donation, the nurse will contact the family by phone and explore tissue donation with them. A full explanation of the donation process and the tissue that can be donated is explained to the family, and the family are then given time to speak to other family members if required and make a final decision as to whether or not they would like to proceed. If the family agree, consent for tissue donation is taken by the phone in accordance with the Human Tissue Act. Only tissue that has been consented for by the family will be retrieved. The family have the option to be contacted when the tissue has been transplanted. Tissue retrieval takes place in the hospital mortuary, hospice or funeral directors. A specialist retrieval team from NHS Blood and Transplant undertake the retrieval and are responsible and accountable for the procedure. The procedure is done aseptically in the same way as any other surgery, so the body is treated respectfully and reconstructed to normal anatomical appearance. The tissue is sent to the tissue bank where it is stored until it's transplanted, and the family can view the body as normal following donation. Tissue retrieval usually takes place within 24 hours after death, so should not delay funeral arrangements. NHSBT has a donor recognition system so that the family can receive an Order of St John's Award or a PIN badge to thank them for considering donation. This badge is worn with pride by many donor families, and they're very keen to discuss what donation meant to them and their family. For more information on tissue donation, you can contact our National Referral Centre and speak to a specialist nurse directly. They can be contacted between 8 AM and 8 PM on 0800 432 0559. The organ donation website also has information on organ and tissue donation, and this includes links to educational videos. Leaflets and posters can be ordered free of charge for your areas from NHSBT leaflets or from the organ donation website. There are also specialist nurses for tissue donation, and we will be more than happy to speak to you about tissue donation and how you can set up a referral system in your own trust. Thank you for listening.